Hello, this is Mandy Butler. I am a nurse practitioner. I work at the Cloverport Health Clinic, and I'm going to talk to you today about gout. I want you to know that this is just some general information. It is not to replace a doctor's visit or to go against what a provider that has examined you has given you the diagnosis. But it's just some information about a disease process so that you can learn more about it and maybe understand some of the things that are happening to you. So today we're actually going to talk about gout and what gout is, what causes it, how you can treat it at home or with the medications, and why it's happening. So gout is a type of arthritis where you have too much uric acid circulating in your body, and it forms urate crystals in usually a joint. It usually affects toes, ankles, knees. It can affect wrists and elbows, but we usually see it in lower extremities. What will happen is you develop a painful joint that usually can become red, hot, or swollen, but it may not. It may just be painful. And you go to the doctor to be evaluated for this painful joint that you don't understand. So what has happened is either your body is not getting rid of as much uric acid as you're producing, or you're producing more. And you produce uric acid when you break down purines in certain foods, and then it stays in your system. And your kidneys are supposed to get that out of the system, but if for some reason the kidneys don't get enough out, or you just have more circulating, it can deposit in these joints. And so some of the foods that you might be eating that could be contributing to this are red meats, organ meats, hard cheeses, beer, wine, sometimes pork. It varies from person to person how their body's going to break down those foods and how much of the uric acid is going to come from which particular purine. So I've had some people that can eat this and they can't eat that, and vice versa, or they might have a flare-up of their gout. So what's going to happen is you're going to have this high level of uric acid circulating in your blood that forms these urate crystal deposits in joints. And one of the reasons why it's going to be in peripheral joints, or joints that are further away from your heart, is that if they get cold, that crystal is going to form easier than if it's warmer, closer to your heart, and closer to the blood that's being pumped to keep your core body temperature up. And so you're going to go to the doctor. They're going to examine you. They're possibly going to do an x-ray of the area to make sure you don't have any other problems going on, such as an infection of the bone or cellulitis, osteomyelitis, which is the bone infection or the skin around it. Sometimes, on rare occasions, you can actually see the urate crystals, but that doesn't happen very often. They'll want to do a blood test to check your uric acid level. That's in itself not diagnostic of a gout flare-up, because some people can have normal levels and still have gout, or they can have elevated levels and not have gout. But it at least gives us an idea on which direction we need to turn. There are some, we also look at your creatinine, which is your kidney function, one of your kidney function tests. Because if your kidneys aren't functioning right, you might not be getting rid of that out of your system. Sometimes we can actually do an actual biopsy of the fluid in the joint that's painful. We look at those, or that liquid, under a microscope, and we might see the urate crystals in the actual joint. That is definitely diagnostic of gout if you have those crystals in the joint. So there are medications that we can use for that. We can decrease the inflammation with non-steroidal anti-inflammatory medications such as ibuprofen, Aleve, one that's a prescription that I tend to use. It can be hard on the kidneys, but it's really good for gout, is Indocin or indomethacin. There's also medications that clear the uric acid out of the system, like colchicine. The one thing about that medication is that it does a lot of times have pretty bad side effects because it's getting that out of your system. So diarrhea, upset stomach, nausea, all that kind of stuff happens pretty frequently with those medicines. Now, if this has happened on more than one occasion or you had it really bad and you don't want to have it again, there are medicines that you can take on a daily basis that will prevent you from making as much uric acid, so it's not going to be circulating through your body, such as allopurinol or Uloric. That's not an exhaustive list, but that's some of them. Some of the things that you can do are you can avoid the foods that you know can produce gout. And all you have to do is Google gout diet. And, you know, I usually go to the National Institute for Health, the Mayo Clinic, the Cleveland Clinic. All of those are very respected, trusted medical websites where you can get those diets for things that you should and shouldn't eat for different conditions. So the bottom line is gout is not fun. It's not fun for anybody who ever has it. If you've had it, you know how painful it is. If you haven't, once you have it, you'll never want it again. But there are ways to treat it. There are ways to prevent it. And this is just a little information to try to help you understand it a little bit better. I hope you enjoyed it. Have a great day.